corporate in charge for YPIA. YPIA is a global network of the United Nations Population Fund. I represent Laos. I represent Asia Pacific Regional Office of UNFPA. And I am also the Fellow of Community Leadership Program of the PSN, which is the special program of AMFAR, American Foundation for AIDS Research, based in New York City. So, I'm going to talk about health, but the health is basically about HIV/AIDS. Okay? Okay, I'm a little bit nervous. Everybody is silent, huh? Let's make it easy. Obama. All right, it's gonna take only 4 minutes. Okay. So my introduction. HIV becomes a global concern as well as the threat to all humans, regardless nationality, country, sex, sexual orientation, religion, and race. HIV has tremendous negative impact to national human resource and several complicated obstacles. It has been reported by the World Health Organization that young people aged 14 to 25 are contracting to HIV/AIDS every day and end up their life in the most devastating way. However, young people in general and young key affected population don't get access to sexual health education, rights to health treatment, and many critical supports. Due to the lack of government support and policies, many organizations around the world are working on youth issues and HIV issues. But you know, the decision is not made by young people, by youth themselves. A lot of money comes to every country on this topic, like $1 million project. But the implication has not been very progressive. That's what I want to stress. Which has, and also young people participation is not involved in the national development program, which has the negative impact to their capacity, leadership, and responsibility to social development of the country and their own health and even their own life. So the solution, I derived this from the advocacy messages of the United Nations high-level meeting in New York City last year. And I'm pleased to inform you that the participation from US exchange alumni is involved in this meeting. So the first one, empower young people at the country level to take ownership of HIV response. Like I said again, a lot of organizations working on youth issue, but young people are not involved. So if HIV response to be inherited by today's generation of youth, then the transference of necessary skills, experience, and capacity from adults to young people at the country level must begin today. And support stronger partnerships between young key affected population and HIV response. Does any one of you know young key affected population? Young key affected population. Again, young key affected population. Okay, I know it's a new term for HIV/AIDS terminology. Young key affected population involved are known as MSM, men who have sex with men, LGBT population. No, this is the original term, the global term actually. And also young sex worker, we can say male or female. And also young people who use drugs, young people living with HIV/AIDS. So we need to support the stronger partnership of these people to get them involved in the global AIDS program around the world as well as the national level. Because we have to make sure that their voices are heard at the national level. Acknowledge and respond to the diversity of young people. Young people are composed of diversity of subpopulations. Like I said, the subpopulation, there are so variety. and have unique changing needs with respect to rights prevention, treatment, care, and support, which means that different interventions in each country or in each subgroups, they have different kind of atmosphere, you know. If you work with young people who use drugs, make sure that the service is friendly and applicable to their circumstance. You cannot mix young MSM, mental health with men, with other general populations. Because you can imagine the doctor, the physician at the hospital, maybe the clinic, not a clinic, maybe the patient is sex worker, and she negotiate her or his problem with the doctors. Maybe the doctors have lack knowledge about that. So now I'm trying to urge for the response of these people requirement in terms of treatment. Address legal, policy, social barriers that young key affected population face beyond prevention, treatment, care, and support. Young key affected population bear a significant burden of HIV epidemics across the world. They must live in the support, therefore they must live in the supportive households, communities, and countries where social norms and policy and laws protect their rights. Ensure that socio-economic needs of young people living with HIV are addressed, including the availability and sustainability of ARVs and treatment options. ARV stands for antiretroviral. It's a treatment that should stop the spread of HIV in your body. Not your body, I mean in the body of positive people. So we have to make sure that young people living with HIV get access to the ARV treatment, because these populations, they carry a heavier burden of looking for finances for their survival, for the cost of the treatment. So that's why the government should identify and support mechanisms to increase access to treatment for young people living with HIV. And the last one, support integrated funding of sexual and reproductive health and HIV interventions for youth. Government should provide funding that supports integrated programming for youth to leverage efforts to prevent HIV and promote sexual health and education. Sexual health and reproductive health education and rights for young people. I can give you the example. For example, in Laos, we cannot integrate the sexual education in the school curriculum. So we are trying hard to integrate this topic in the national education. So we have to include a lot of this information to our country through the education mainstream program, or those NGOs who work on this topic. Make sure that that is the proper peer education program to make sure that this information is spread and shared. So the needs that I would like to give for you guys. First, the qualitative and quantitative research must be conducted in all countries to make sure that you know your prevalence, you know your country is epidemic. Before intervention of HIV/AIDS, you have to know your national prevalence first, and then know your problem in your country. And human rights advocacy for young key affected population must be addressed. And communication advocacy and media support is also significant. And the last one, community mobilization for development in all respects, not just HIV/AIDS, just like our moderator Terry told us this afternoon. So lastly, I want to tell you guys that please respect and embrace the diversity. And here I can see all the diversity in our conference. And we will love each other. Thank you very much.
Just quick survey. Is HIV/AIDS a big problem in you guys' countries? Sure. Thank you